Sam, you can go ahead and share your screen, and we'll, like I said, we'll take questions at the end, or you can drop them in the chat.
It's like every time I try to do it, where are we at here? All the other like Zoom things. Such. There we go. That's up and good?
Yeah, we can see it.
Cool. Thank you. Thanks, Teresa. So, yeah, my name is Samantha Pickering. I work for the Michigan Environmental Council as the Public and Environmental Health Policy Manager. But like as Teresa noted, I've done my MPH practicum with them. So I've been at Wayne State, wrapping that up. So I'm doing a master in public health and urban sustainability. So I've sort of hodgepodge together this dual title opportunity, but I've sort of created a like environmental health, public health master's for myself over there, and was very grateful to be able to be placed with Micah to do my practicum work because it's just a very strong mission to have so many healthcare workers and professionals that are very concerned about climate change and all of its impacts. So my research is on the cumulative impacts of extreme heat and poor air quality and how that is on the health of Michiganders. Am I gonna be able to click? Okay, cool. So we're gonna like walk through everything, and I have a few different objectives for this research. And first of all, it's the definition and like a framework for defining cumulative impacts and just kind of sharing why that's important to public health when we're considering these things and researching them. And then we're going to just kind of review some of the health impacts of extreme heat and poor air quality. And then we'll dig into more of like my qualitative and quantitative findings. This is essentially like a qualitative descriptive study that I put together here. And we're also going to discuss some of the more vulnerable populations and how the social determinants of health are shaping those vulnerabilities and contributing to that. So to ground us in, we're all pretty aware of climate change. It needs to be more so considered a public health issue. I think we just kind of see climate change as a buzzword. Some people in the environmental field don't even like using it anymore because they hear it so much, but it is true and real. And globally, the temperatures are projected to rise about 1.5 degrees Celsius between 2030 and 2052. And this temperature increase is largely driven by human activities. So the Earth has ebbed and flowed, and ecosystems have evolved and adapted over the entirety of, even before humans existed. But once we came along, an industrial revolution hit. Ever since then, we've just been contributing way more to the climate and stressing the earth out. And a lot of it's just from like land use changes and our emissions and the way we live and practice everything. So because of all of that, we're starting to see more frequent and intense extreme weather events. Like we were just chatting about the recent flooding before all of this, starting the presentation and everything. But more importantly, these stressors do not occur in isolation. People are more so often exposed to multiple stressors at the same time. So, for example, here tonight, we're going to chat about extreme heat and poor air quality occurring together. But there's also things like inside of your home, like if it flooded and maybe there's some mold you don't know about that can contribute to poor indoor air quality. So, then if you have lead paint and like on your windowsills and that turns into dust, then you're being exposed to other contaminants and those impacts become cumulative as well. So there's a lot of different environmental stressors and factors that contribute to our life every day. And this is where we're seeing it's a significant enough gap, I think, in research because a lot of studies are examining these exposures separately and not considering them together. And when they are considered together, it varies quite greatly across the board. So zooming in to Michigan, so we've got global changes happening everywhere. It's different everywhere. When we look at Michigan specifically, we're seeing these impacts already. So our region is experiencing warmer winters and longer warm seasons, and these are extending the duration of exposure risks. And then we have things like precipitation, which has increased to about 14% since 1951. And that's contributing to different environmental changes that can also affect air quality. So, just this past winter, we had a few bad air quality days when all the snow was melting. And that's because the fine particulate matter was like trapped in the snow and the water particles. And as that melted, those particles were then released into the atmosphere, and created some bad air quality days for us. And then looking at Wayne County specifically, because this area has a lot of disproportionate impacts. There were 15 extreme heat days in Wayne County in 2023, and it also received an F grade for air quality in the State of the Air report for 2025. So these aren't things that are like going, it's not a future issue. These things are happening and it's already affecting population health. So, looping into our cumulative impacts framework, the cumulative impacts refers to combined and synergistic exposures that lead to worse health outcomes than any one single exposure alone. And one key distinction I wanted to make within this work is that the terms effect and impact are different. So much of the literature, when I was doing my literature review and researching, you put in cumulative impacts, and a lot of what you get back is cumulative effects. And did a little bit of digging on the words, and the word effect tends to imply like a single isolated outcome, while impact better captures the combined and often like amplified consequences of environmental stressors or just stressors in general. So this framework integrates environmental exposures with the social determinants of health, and by also including things like housing, income, and access to healthcare. And, so instead of looking at things in isolation, we're defining them in a holistic, comprehensive manner so that all things are being considered. And that way, we have a better understanding of how these impacts are playing out and then how to, create interventions around that. So instead, we're starting to ask, like, what happens when these things occur together, and especially in populations that are already vulnerable. So we're going to just chat briefly about the health impacts of both extreme heat and poor air quality. There's a wide range of health impacts on both of them. Looking at extreme heat, these heat-related illnesses include things like heat stroke, heat exhaustion, cramping, some of which can become life-threatening. Some populations are more at risk than others, like our senior population, those already living with chronic conditions, and then individuals living in urban areas where we have the heat island effect, and that's going to intensify exposure due to things like a lack of tree canopy and a lot more impermeable surfaces. And then outdoor workers are another one too. They're, the ones helping us put food on our table, and they're outside and dealing with prolonged exposure as well. So not only that, but the extreme heat also impacts the healthcare systems themselves. So it increases patient volume, and that can put additional strain, because there's already a lot going on for providers and just like the infrastructure for healthcare centers. And then looking at air quality, we have our key pollutants. So the National Ambient Air Quality Standards with the Environmental Protection Agency requires monitoring of 6 key pollutants, and those include particulate matter, ozone, nitrogen dioxide or NOx's, NOx's, sulfur dioxide, lead, and carbon monoxide. And these are the primary pollutants that are monitored as told to us to do by the EPA and the Clean Air Act. And the states then have to implement their own monitoring plans from there. But what this kind of leaves out is that there are a lot of other key pollutants that are less monitored that can be precursors for those National Ambient Air Quality Standard pollutants. And we'll get to that a little bit more later. But these pollutants have a lot of different impacts. So they can impact primarily like our respiratory system, but also cardiovascular. And there are even some mental health concerns and adverse pregnancy or birth outcomes. And again, these are not evenly distributed. Folks with pre-existing conditions, those living in low-income populations, and communities in urban or highly industrialized areas tend to experience greater and prolonged exposure and worse health outcomes. And then if you're low income and you have like an hourly wage job where they don't provide health insurance, your access to health care is also something that is a barrier as well, even if you like have a lack of access to transportation. So, but most importantly, we need to note that climate change is expected to worsen air quality over time, especially through things like increased wildfire smoke, which we're starting to see more and more of every year. So now digging into the methodology, it's like I noted before, it's like a qualitative descriptive study where I did a qualitative survey and also sift through some quantitative data. So first came the survey. It was distributed to 21 healthcare, no, it was distributed to more than that, but we had 21 healthcare professionals respond to the survey. It was a variation of open-ended questions intended to capture real world clinical experiences. So what is being seen in practice these days? And these participants were recruited using the purposive and convenient sampling methods. And I used Micah's amazing network and also tapped into some connections with the Michigan Department of Health and Human Services for them to help distribute it to their network as well. And then I analyzed some quantitative data from 2025. It was through the EPA. It was from EPA. It was air quality index data that I sourced from the Wayne State Phoenix Project, which is a really large database that has a lot of great stuff in there. So I was grateful to find that. And then combining these two methods together allowed me to be able to connect the lived experiences with some broader environmental trends. So the qualitative data analysis, I used an inductive thematic analysis approach. And by what that means is I basically developed everything directly from the data. So sometimes you can like predefine your themes. I decided to go through and look through everything. So I did some initial coding, then created a code book, recoded the data from there. And from that point, I was able to identify four key themes that we'll dig into that were supported by participant quotes. And I just like this approach personally because it allows things to emerge organically. Yeah. And then from the survey, we had a pretty diverse group of folks that responded. There were 21 different healthcare roles and settings, like a nice diverse range. So there were medical doctors, physicians, nurses, nurse practitioners, folks that have more like specialized areas, and they worked across different places too. So hospitals, outpatient clinics, private practice, and then some from like academic or even government settings. And I think this overall strengthened the findings. So because we had just a lot of different perspectives across the system. So it wasn't like the largest sample, but I feel like it was very rich. And then from all of those responses, like one of the questions we asked was, what impacts are you seeing in practice during extreme heat? And then what are you seeing during poor air quality? And there was a lot with like the respiratory system. So specifically asthma and COPD exacerbations, those were highest for both. But there were also things like with extreme heat, there was more dehydration and heat-related illnesses and some mental health concerns. And then for poor air quality, there was also an increased use of medication and more hospital admissions on top of like the respiratory distress. And this table here basically just quantifies those observations. Again, showing respiratory symptoms were dominant across both exposures. And The patterns do differ though. So this also just reinforces the idea that the exposures interact in some complex ways. So looking at our themes from our qualitative data, the first one that came across was the health impacts. And I think this is probably one of the stronger themes that was in all of that data is just the direct impact on patient health. The providers consistently reported respiratory distress, worsening chronic illness, cardiovascular strain, and then mental health concerns was consistent across the board too. There was one participant who was a psychologist, but it worked in that field specifically, but everybody else, not everybody else, but many others had noted that as well. And most importantly, they emphasize that these impacts are worse when exposures occur together. And I thought this quote from the responses highlighted it quite clearly, noting that many of my patients have COPD and I see increased exacerbations, and even construction workers are affected by heat. So, just taking that into consideration, I wanted to note that, if you're doing road construction and it's a hot day, so you're dealing with the heat and you're also along or in a highway, depending on how the construction is set up, you're dealing with a lot more air pollution during those times and prolonged exposure. So this isn't traditionally or limited to like the traditional vulnerable populations. It's broader than that, and that it's impacting all of us. And the other major theme that came out was the disproportionate impact on certain populations. So populations most affected included seniors and children, folks with chronic disease, outdoor workers, and those in low income and minority communities. And these groups are experiencing higher exposure and or have a reduced ability to cope once they're dealing with symptoms. And this quote, I thought, illustrated the physiological burden about how the heart and lungs are working harder under the combined stress. And then also the social determinants of health play a critical role in shaping exposure and outcomes. One of the most emphasized factors within the responses was housing. So housing quality and condition, and then there's also economic stability. So are you able to take a day off work if you work outdoors and it's too hot and you can't do it? Like, can you literally like afford to do that? Can you lose that money? Education is another thing. Like, what do we understand about how these stressors impact our bodies? And then also access to healthcare. So, for example, having a lack of air conditioning or inability to afford things like air purifiers is going to increase risk significantly. So if you're living in an older home in an urban area like Hamtramck or something, and you don't have central AC, but it's hot out, so you open the windows, but then we have a bad air quality day, that air pollution is welcoming itself right inside. So vulnerability isn't just something that's biological, it's also structural. Whoops. Okay. Sorry, I've like got the dual screen thing going on here. All right. And another thing that came out of all of that was the need for resources and interventions for both the healthcare providers and patients. So the provider responses emphasize things like cooling centers, having access to air conditioning and air purifiers, having affordable medication and, energy efficiency in the home, like utilities costs if you have an air conditioner, do you want to run it because it's going to just jack up your utility bill that much? And also better communication strategies. So, how are we having these conversations and sharing information in a way that is accessible to folks? So, a key takeaway here is that no single solution is sufficient. This is certainly a interdisciplinary and cross-sector um, collaboration. And this quote from the responses, I thought really highlighted all of that. Like it just to me, encompass all of these issues. So from energy grid and, potential loss of power, having resources to help afford inhalers and being able to regulate the temperature in their homes, and then being able to share information about the dangers of these stressors. And now shifting into the quantitative data. So this is all data from 2025 from the EPA, and it's air quality index data, so AQI. It essentially had the number of it had like 23 different counties. Nope. I think like 27 or 28 different counties in Michigan. And it had the number of days that each of those counties had bad particulate matter days, the ozone days, and then each of the AQI thresholds. Like, was it unhealthy air quality? Was it moderate? Was it a good day? And I just kind of took all of that and looked through it for a really long time until I started to see some patterns that aligned with what, everything that was brought up in the qualitative data and be able to support that. So through that, I went through and broke the counties up into urban and rural based on the MDHHS definitions of that and how they do it. So I just tried to align it with that, which did things like included Oakland County as urban compared to rural, but it's suburban. So, but suburbs wasn't an option within that. So I just tried to keep it simple with those. And, after kind of going through all of the different bad air quality days, I identified that the urban counties had 69 unhealthy air quality days and rural counties had 12 in 2025. So this is a very substantial difference, and it reflects the higher pollution burden in urban areas, but also helps us illustrate how climate impacts vary in different regions. And then it just kept getting more and more complex. So when we look at specific pollutants, the urban areas tend to have higher rates of particulate matter, and then rural areas have higher ozone levels, especially during heat events. And that happens because heat accelerates chemical reactions that form ozone, and pollutants can travel from urban to rural areas. But it gets a little bit weirder from there. So in the urban areas, there are higher levels of the NOx's, the nitrogen oxides, from sources like traffic and industry. And those NOx's react with ozone and breaks it down, which can actually lower ozone levels. So that's why ozone is lower in urban areas. But in contrast, the rural areas have less NOx's. So then that titration reaction that happens in urban areas happens less and allows ozone to build up, especially during hot days when ozone formation is higher anyways. And titration basically just refers to a chemical reaction where the NOx reacts with ozone and removes it from the air. So it can sort of just like cancel it out. And then that means some of these exposure patterns are varying geographically, which has important implications for intervention strategies because they then need to that just needs to be considered in how we're treating across the state and how we're looking at the issue. So overall, I say there were like three main findings from all of this. So first is the cumulative exposures and how those are worsening health outcomes. Then the significant geographic disparities and just variances in outcomes between urban and rural regions across the state. And then also the major gap in resources, preparedness, and communication as identified by the healthcare providers. One major takeaway from this with me too is that equity is central to this issue. So environmental exposures are disproportionately impacting populations that are already disadvantaged. So they're already dealing with so many things, and climate change is happening and getting worse, and it's making it's overburdening certain communities. And this includes factors like housing conditions, income, chronic illness, occupational exposure, and social determinants shape both exposure and our ability to respond to it. So it's not just like vulnerable populations, like they are vulnerable, obviously, but it's a systemic issue. They're systemically overexposed to these pollutants and conditions. And then in terms of limitations, there were quite a few, mostly just my timeline and when I had to get all of this done because this was for school. And, when we started this project initially, we wanted to look at this from a different angle in the data. So we wanted to look at hospital data and look at the number of emissions on a few specific dates. So I had dates from like bad PM 2.5 wildfire smoke days and high heat days, like when those 2 days were occurring together. And I wanted to compare those dates to what hospitals were seeing. So like were there more admissions, excuse me, and visits on those days? But that data was unfortunately not available within the timeline. So we transitioned a couple of times, but also just for the study in general, the qualitative sample size was small, but it may not be like fully representative. It covered a wide variety of um, zip codes. We collected zip codes and the locations where they were at. So there were many different counties within that, but it was concentrated to the Lower Peninsula. The quantitative analysis relied on EPA data, so it didn't fully integrate the heat data and the hospital data that I wanted. The way all of these data pieces are out there is really complex. And that's one of the things I also kept thinking about throughout this process too. Like we need to find a way to sort of hone in on some of these data sets and bring them together a bit more so that this research, when somebody wants to research something like this, it's just more accessible. And overall, generalizability was somewhat limited just given the nature and structure of this research, but I do think that the findings provided some valuable insight into a less researched area. And one other thing that came to mind yesterday that I wanted to put in the slides, but I forgot to, is where the air monitors are across the state. So it's quite variable. For example, there are only 2 monitors in the UP. Both of them measure ozone, but only one of them measures for fine particulate matter for PM 2.5. So that I think is important to note because when the wildfire smoke is coming down from Canada, depending on the wind pattern, but the UP is gonna kind of take a lot of that initial hit depending on how it's coming down. And they did see their first bad air quality day not this past year, but maybe the one before. Like it was on the news because they had never had a bad AQI day. And that is pretty consistent throughout the state, though, because then you start to, I'll just use my hand because I don't have the picture I wanted, but we had like the 2 in the UP, and then as you kind of come down the west side of the state, there's a whole barrage of different air monitors, and then when you loop around to the more southeast region and like middle section of the state, there's like highly concentrated um and very dense, like a lot of air monitors, especially in Detroit. And then there are a few kind of up here on the northern east side, but they're all measuring for different things. And as I kind of discussed a little bit earlier, when pollutants interact, they can form entirely new compounds. So the way we're monitoring, and I get it, like those monitors are very expensive. It's, difficult to manage and keep up with and all of those things. But when they're not all monitoring the same things, I feel like we're doing a bit of a disservice in that we're not capturing the entirety of the issue. And it's like no fault to the state, no fault to anyone. That's just how things are in practice. But I think considering how these, new compounds can form and how those then impact public health need to be considered more, and that needs to be elevated. So, like how heat and precursor emissions contribute to ground level ozone. Um, and some of these monitors are just tracking things in isolation. And, we're not fully capturing the combined exposures in real time. So this is just creating more gaps in data, and those gaps are often largest in the same communities that are most exposed. So yeah, and like one other thing I wanted to note is that the air quality index isn't the best representation of the true impact, but it is the most publicly recognized, which makes it good for communication. And I think even more people are becoming aware of AQI if they didn't know anything about it before, because when you go outside, you feel it. And then, eventually you look at the weather app or something and you can connect those dots. So, like, that is one positive of it, but it's not the best tool for measuring the entirety of the issue, basically. So, and then we see a similar issue with heat data, and extreme heat is often measured using broader metrics like temperature or heat index. And those don't fully capture the localized exposure either. So, places that have the heat island effect, or various housing conditions and access to cooling, those things aren't considered in that as well. But when we look at how we're measuring it and what tools we're using and what's the best way to measure it, metrics like the wet bulb globe temperature is more comprehensive because it accounts for factors like humidity, solar radiation, wind speed. All of those things help provide a better sense of how heat is actually experienced by the body. However, this metric isn't used consistently within the public health realm, but even in practice in those that are measuring heat, because these tools are often more expensive and more difficult to use. Yeah, so basically, just like with air pollution, the data doesn't fully reflect the lived exposure and experience, and that can also mask disparities at the community level. So, whoops, too far. Okay. In terms of different public health implications, we need to really focus on equity-focused interventions, things like increasing access to cooling centers and providing transportation on those days. We're good at predicting when these days are going to happen. So, having solid preparedness plans in place and doing that at the local, like either municipal or county level, that really needs to be taken into consideration across the state, and even the nation, honestly. But also getting access to air filters, those can be a significant cost barrier for folks. There are quite a few organizations that are doing those box air filters and helping people make them to have in their homes. But those are also just, in very isolated pockets. So finding a way to expand that more across the state to help more folks have access to that. And then energy assistance, energy affordability, utility affordability, DTE just asked for another rate increase. And, these things just keep happening because some of our industries here in Michigan are monopolizing the system. So it's not really helpful when you're dealing with a bunch of systemic barriers. And lastly, I'll note that we need better communication strategies that are relevant, accessible, but also culturally appropriate. So ensuring we have things taking all of that into consideration and having them available in the necessary languages so they can be understood and digested by who's reading it. And all of this requires cross-sector collaboration. So we have healthcare providers, we have policy, urban planning, and way beyond all of that. And to sort of hone in and wrap everything up, cumulative impacts of extreme heat and poor air quality are increasing and becoming more visible in clinical practice. These exposures are leading to worsened respiratory, cardiovascular, and mental health outcomes, as well as increased hospitalizations, as we found through the qualitative study. And vulnerable populations are already overburdened and be disproportionately impacted. And overall, the ultimate takeaway from me for this is that in addressing this issue, we need holistic, equity-centered strategies that are reflective of the complexity of these real world exposures. So any environmental issue or what have you is complex in nature, and you can't go at it with this like isolated lens thinking if we just plant more trees, we can deal with the heat island effect, or we can, have them take in more of the air pollution. And because trees store that in their roots and it's great, but it's like that's not it. We need all of these um, you know, collaborative efforts to be able to have long-term and sustained progress that really helps improve public health and, you know, our public health outcomes essentially. So with that, just wanted to take a moment to again thank Lisa, Teresa, all of the MICA members that were so gracious to fill out the survey. I had emailed everybody individually, and a lot of people responded back, which was really sweet. And then some folks at Wayne State, my practicum director, and a couple of my professors that were very helpful in being like thought partners through this process. And also my job, Michigan Environmental Council, they were very gracious in, allowing me to take some time to really work on this and helping me pick up pieces where I needed help and all of that. But yeah, I thank you all very much for your time as well and for listening. And I am happy to answer any questions.
Uh,